Hello friends, let us now learn some important points about the focal solid splenic mass. In that, first we will see the malignant focal splenic solid masses. Malignant focal splenic solid masses include lymphomas, metastasis, angiosarcoma and hemangiopericytoma. First we will learn some important points about lymphomas. Lymphomas. Spleen is more commonly involved in patients with lymphomas. So, in lymphomas, spleen is also most commonly involved. And patients with lymphomas, any type of lymphomas, they might also present with any lymphadenopathy, especially they can have abdominal lymphadenopathy, and they might even have some constitutional symptoms like fever, weight loss, anorexia, and other symptoms might be present. And lymphoma can be present either in Hodgkin's disease and non-Hodgkin's disease. In Hodgkin's disease, almost in 30 to 40% of patients having Hodgkin's disease will have splenic enlargement. Almost in 30 to 40% of patients might have splenic enlargement, and almost one third of the patients have no lymphomatous involvement of spleen. So, in almost one third of patients, there is no involvement of spleen. In 30 to 40%, there is splenic enlargement. In one third of patients, there is no involvement of spleen. So, there it is not like uniform. And the rest one third, so if there is no involvement of spleen, obviously the patient will have normal sized spleen is present in one third of patients. So 30 to 40% you will have splenic enlargement, and one third of patients will have normal sized spleen. This is in Hodgkin's disease. Then if you see in non-Hodgkin's disease only if you see 40% of patients, in 40% of patients with non-Hodgkin's disease, spleen is involved, and in rest of them, spleen is not involved. Then, then in lymphomas, there are four patterns of disease is seen in lymphomas. Four patterns are seen in lymphomas. So, if you see, these are pathological findings. There are of four patterns. One, we might have diffuse involvement of spleen with enlarged spleen. The spleen is enlarged diffusely, and there might be normal echo texture might be seen to the spleen, but it is increased diffusely, or there can be patchy inhomogeneity, that is patchy differentiation in echo texture may be seen also. So this is diffuse enlarged spleen with almost normal echo texture, or some patchy inhomogeneity may be seen. This is pattern 1. Then in second pattern, there can be focal, that is small means less than 3 centimeters focal hypoechoic nodules may also be seen. There can be focal hypoechoic nodules might be seen also. Like for example, if this is the spleen, you might see this is the normal echogenicity of the spleen. Okay, then maybe you might see presence of small 3 to less than 3 centimeters hypoechoic nodules might be seen. Then the third pattern is here also there is focal, but here there are small less than 3 centimeters. Now large, that is more than 3 centimeters, nodular lesions might be seen. This is the third pattern. That means if this is the spleen and this is the normal echo texture, you might see either hypo or hyper, it's not mentioned, but there is more than 3 centimeters nodular lesions are seen in the spleen. Then fourth is there can be presence of bulky solid mass might also be present. Okay. So if you see the patterns of lymphoma, these are numerous small nodules are seen. These are numerous many, and you can see presence of small nodules are seen in patient with lymphoma, T cell lymphoma. Here you can see presence of large nodules. These will be definitely more than 3 centimeters. Here small nodules will be less than 3 centimeters. They are hypoechoic. So this is also seen in lymphoma. And here you can see presence of solid mass. Then bulky solid mass is seen in the spleen. And if you see here, there is diffuse involvement of the whole spleen is also seen with no focal abnormalities. It is involving diffusely. So these are the four different types of um, focal lesions or four different types of patterns seen in lymphoma. Patterns of spleen involvement seen in lymphoma. Now, um, yeah. So if you see the focal lesions of the spleen, so these splenic lesions in lymphomas, these are most commonly they are hypoechoic, as you have seen before. Most of them are hypoechoic and they are hypovascular. So these, if you see, all these are hypoechoic lesions. Not even one is hyperechoic, right? So hypoechoic are seen most commonly, and they are hypovascular lesions may be seen. Then, if there is after the central necrosis, after, because whenever there is lymphoma, there is growth of cells, and that means there is growth of all the cells is present as a mass, and slowly liquefaction start. That is, central necrosis will occur. Once the central necrosis will occur, the central necrosis will look like in liquefaction. So, along with central necrosis, you will see presence of liquefaction. At this stage, you will see that these lesions appear as either an echoic cyst or they might appear as an abscess or they might mimic an abscess. So, when after central necrosis or liquefaction or subsequent liquefaction, these focal lesions might appear as an echoic cyst or it might mimic the abscess. So, sometimes you might see presence of isolated lymphoma also. That is, there might be presence of isolated splenic lymphoma. This isolated splenic lymphoma is actually rare, and this is seen in only less than 1% of patients with lymphoma. In less than 1% of patients suffering from lymphoma, we will see this isolated splenic lymphoma. And it is and this isolated splenic lymphoma is present in, or it represents, in most of the cases it represents Hodgkin's disease. So these are the important points about the splenic lymphoma, which is one of the malignant lesion of the spleen. Thank you.